Welcome to In the News with Double O Des. I'm Des Bernardo, giving you my perspective on news from South Africa and the rest of the world. In the news now, I bring you an article that should probably be disturbing to most of you. And it all depends on where you align yourself with regards to freedom, choice, freedom of movement, freedom to be able to move without being monitored. And in this case, this pandemic has brought along something that has definitely suited many governments and many countries to implement things that I will describe in later videos. In this headline, in healthcareineurope.com, the headline reads, sold 50 million digital health passports. And I'm going to go through this article carefully so that all of my subscribers can understand the full weight of what is being discussed now and what that means for you and your life and your freedom. Please ask your friends to subscribe to this channel. I will be discussing these articles in detail. I have a lot of knowledge on this. I have a lot of background in this. And this helps me to give you perspective both on the past and the history with regards to what is being rolled out now within the world. And although we are all aware, and I am aware of the specifics of this global plan, to see it in action and to see how rapidly these things can be implemented is still mind-blowing. And for us to be on our guard and actually do what we think is necessary to maintain and retain our freedom is paramount at this stage. The actions that we need to take. Below the headline it reads, a British cybersecurity company VST Enterprises has signed a contract with international digital health technology firm Circle Pass Enterprises, CPE, owner of the COVI pass, to supply 50 million of its digital health passports to 15 countries. And lo and behold, South Africa is one of them. Let's go into a bit more detail. VST was founded by tech entrepreneur Louis James Davis to integrate in state-of-the-art V-code and V-platform technologies into the COVI Pass digital health passport, which will be paired with approved testing kits. Can you people see where this is going? I know personal friends who live in Australia that are already subject to apps that control their very movement. But this gets worse. Put simply, the user downloads the app to their smartphone device and uploads his or her key information such as name, address and age. Their identity is then verified using a biometric fingerprint. Think of horror movies with fingers being chopped off to actually get access to certain things, right? Fingerprint or facial scan. So we're going on to facial scans as well. A COVID-19 test is then carried out by an authorized healthcare professional, nurse or medical doctor. The test is geofenced to that location. Now, it's important to understand what geofencing means. In geofencing, you are located exactly where you are. In other words, this system can track your every movement. And this geofencing of your location is done using a GPS, RFID, a radio frequency ID, Wi-Fi or cellular data, to set a virtual boundary around a geographical location. And the test results are then scanned from the testing kit into the COVI Pass health passport. So this is the first time in history where we will be digitally scanned to prove that we don't carry a certain disease. And this is why vaccines for COVID-19 disease is being pushed so hard. This is where everything comes together. The end game, the end plan. And you will see later in this article that this is a way and means for lockdowns to end. Okay? So let's carry on. A color mapping system, green, amber, and red, authenticates and provides the COVID-19 test history and relevant health information. So the accurate data metrics can assess those who have tested positive and negative and the location only of their testing. The user can then show the COVI pass to authenticate their health status. A traffic light system confirms their health status as either red or green, red for positive and green for negative, the company points out. Now, in a country such as South Africa, where we have been classed by race, gender, and many other things in the past, I wonder why someone like our President Cyril Ramaphosa would embrace something like this if he wasn't part of this plan from the beginning. And if you watch my videos on Cyril Ramaphosa, you will understand that he was earmarked to be this leader that would actually usher in this New World Order agenda for all our movements to be tracked. Because you will know that there's absolutely no point in doing this when we know that the SARS-CoV-2 virus can, in many cases, you can get it into your body and it could not replicate at all. You won't be tested positive. You can be a carrier, move it around, and no one will know the better. So this ID means absolutely nothing. Nothing. So why are they rolling it out? Let's carry on. The COVI pass can be used as an authenticated gateway for public services, businesses, and employees to manage a safe return to work, life, and safe travel. Think for one moment what I just read. A gateway for public services, businesses, and employees to manage a safe return to work, life, and safe travel. One of the many unique features of the V-Code cybersecurity, adds CPEC founder Adam Palmer, is that the technology can be scanned from up to 100 meters, ensuring its social distancing compliance is robust and making it the only choice for a safe and secure digital health passport. Plus, CPE points out scanning is viable while the person is moving and at various angles. Shipping begins. Shipping has begun for the first phase release of these 50 million digital health passports to the private sector and governments in over 15 countries, including Italy, Portugal, France, Panama, India, the US, Canada, Sweden, Spain, South Africa, Mexico, United Arab Emirates, and the Netherlands, the company reports. We firmly believe that the digital health passport alongside government-approved testing kits is the key to removing the lockdown restrictions in a gradual and controlled way. People, there you have your answer. Justice Killian, there you have your answer. Justice asked me to respond to Agenda 21 Truth South Africa. He asked me whether this lockdown will continue until a vaccine is rolled out and digital IDs are rolled out. Here is your answer, Justice. People, please subscribe to Agenda 21 Truth South Africa. It is a channel that'll make a massive difference in your life. Justice has spent 8 years of his life researching this. He is an expert in anything related to Agenda 21 and 2030. This is not a game. This is extremely serious. Myself and Justice and many other people are at the forefront of fighting this. We have both left our careers behind because there is no more choice left to pursue and fight this New World Order agenda full time. And as I continue with this article, the cold, chilling reality will hopefully settle in your mind, in your heart and your soul. I want you tonight to go and sit back, read this article, which I will link in the details below, and think and ponder on the meaning of this in your life and your privacy. We believe firmly that the digital health passport alongside government-approved testing kits is the key to removing lockdown restrictions. I have to repeat that in a gradual and controlled way. Can you remember what the World Health Organization said? What Cyril Ramaphosa decided to go with when our own MAC expert said, open up to level 1. What did Cyril Ramaphosa say? The World Health Organization said, stay at level 4. He said, we decided to go with level 3, which is kind of in between, and we need to do a gradual and controlled opening of the economy and of the lockdown. And they're adding here, the current technology being trialed using Bluetooth and proximity apps is fundamentally flawed because of its privacy issues of real-time tracking. So they're talking about the current tracking systems, which our government has spent a fortune on already. The security and data breaches which we are already seeing and being reported, and the reticence for citizens to uptake and download the tracing app. So they are experiencing problems with the current tracing systems the government has implemented. They have made thousands of phones available, all these apps to control people, see where they're moving and all the rest, for nothing. So this is the new way forward. Existing health passport problems. It almost sounds like this was done deliberately so that the real deal can be rolled out. And so that a valid reason is made for the real deal, which is a proper tracking system, which controls your very life, every aspect of your life. Existing health passport problems. Obviously, they need a reason to roll out this new system. The technology used in contact tracing and Bluetooth proximity apps currently being used by various governments is fundamentally flawed, Davis believes. Not only can Bluetooth app and its data be compromised and hacked, but it can also lead to false flag data. There are also real fundamental issues of privacy and being tracked in real time, which most citizens will resist at all levels. This will also contribute to anxiety about the technology, thus resulting in poor uptake. Without 100% uptake of the population using the technology, its data is ineffective. They want every one of you to be controlled by this. Do you comprehend what is happening? Are you willing to bow down to this? Do you understand what this means? So, 100% or nothing. This is the aim. And it does not give a true picture of the virus tracing. So the virus is purely being used as a means to control our every way of life and movement. Add into this the fact that Bluetooth can also penetrate glass and walls. So someone, for example, who is self-isolating in a house that is tested positive for COVID-19 would give off a false flag to someone walking past their house who has tested negative, that they had been in proximity to someone who has tested positive. So what this system does, it will actually say that if you've been close to someone that has been traced as tested positive, you are going to be negatively affected by this. This is absolute madness. If this video does not go viral everywhere and the whole of South Africa sees this, I don't know what to do anymore to help the people of this country. Because you need to spread this far and wide through all your friends and family. Please subscribe to the channel. If you don't want to subscribe, don't do that. But then at least share this with everyone you know. Everyone needs to know this desperately. At present, the problem with other health passports is not only that the feed of information is voluntary, but the technology being used in most cases, a QR code or barcode, can't be interacted with outside of the safe distancing zone. So with this new technology, what they're saying is they can actually track you from much further, up to 100 meters. And the fact that it's voluntary, they want to make this Involuntary. You will be forced to use this. Data and sensitivity information scanned or stored in either QR code and barcode can be hacked and are inherently insecure, leaving data and personal details to be compromised. Both barcodes and QR codes are old second-generation technology. VC Code and V-Platform represent the next third generation, just like 3G, third generation cell phones, of ultra-secure and versatile code technology to military-grade encryption with over 2 quintillion code permutations. So they're saying this is perfectly safe. People, there are many articles related to this. I will put the link for this article below in the description. Please read the article. Take the article headline, put it into Google and look at other related articles. I've looked at many of them. And it is frightening to see how the big master plan is for everyone to have this ID. And a radio frequency ID, you know what that is. That is a chip inserted into you. A chip. That's what an RFID is. Go and put RFID into Google and see what an RFID is. Then go and look at the smallest RFID available. The smallest. It is like dust. Go and look and see what is possible today and what these people are up to. Please subscribe to my channel. Please hit the bell icon to get notifications. And in the somber moment, I want to ask you again. Go tonight. Go and Google this problem. Go and look at the other articles. Read about them. These are people that support this. They are not fighting against this. They believe this is the way to go. And this virus that is all over the world now is the way and the means to implement the system. Welcome to the New World Order. Welcome to George Orwell's 1984 dystopia. Because a utopia it certainly is not. Till the next video.